CPDE is proud to bring you the global synthesis of its study titled World in Lockdown, Development on Hold, a special CPDE report on the ineffectiveness of the COVID-19 response. Amid the COVID-19 crisis, CPDE mobilizes members around the world to conduct research on the pandemic response through the lens of effective development cooperation. Presenting the synthesis of CPDE's global multi-stakeholder research. Here are 9 main points from our research. The reliance of developing economies on a market-oriented and market-led global economic system has affected their domestic capacities to overcome social and economic shocks due to COVID-19. Structural deficiencies, particularly debt servicing, compound the uneven or even weak implementation of COVID-related social protection measures in developing economies. While several governments provided support to those whose incomes were affected by the pandemic, these were temporary, limited in scope, and largely excluded workers in the informal economy. Of the 96 million people projected to suffer from extreme poverty following the pandemic, 47 million are women and girls. Many states have used the pandemic to attack human rights and civil liberties, such as the freedoms of movement, association, and organization. Some countries have tended to rationalize excessive police force in lieu of rolling out comprehensive medical solutions as a primary response to the pandemic. Attacks on democratic rights and spaces limit systems and mechanisms for promoting effective development cooperation principles in the pandemic response and undermined the position of civil society organizations as development partners and independent actors in their own right. Aside from being a public health crisis, COVID-19 is also an international development crisis, with severe implications on attaining development objectives and international cooperation. Despite the pandemic's challenges and the shrinking of civic space, CSOs have continued to engage in advocacy work, helping create alternative development plans, especially for the marginalized, to leave no one behind. We thank the following organizations for their participation in this research. To learn more about our COVID-19 initiatives, visit this page.